What is anemia? Why are you always so cold and why are you always so tired? Let's talk about it. Anemia, iron deficiency. Anemia means that your body doesn't have enough healthy red blood cells to carry oxygen. Why does this matter? Less oxygen means fatigue, weakness, shortness of breath. Within our bloodstream, we have red blood cells, we have white blood cells, but a major important aspect for our red blood cells is to be able to carry oxygen from our lungs to our tissue. If you feel tired, weak, shortness of breath, this could be a sign of iron deficiency. Basically meaning that you have immature red blood cells due to the lack of iron. And this is a really important aspect of why iron is such an important nutrient. So if you are iron deficient, you can take iron supplements, oral iron. It can be Fe, FeR, FeRR. The bigger the dose does not mean that it works better. The bigger the dose, you could have more adverse events and side effects. So be very cautious of the dose. Typical dose is 65 milligrams. When taking oral iron supplements, you must take it on an empty stomach. Do not take food when you take this. Take it on an empty stomach 1 hour before or 2 hours after you eat. You want to make sure that you avoid taking iron supplements with H2 blockers or proton pump inhibitors, such as omeprazole, Nexium, famotidine. Reasons why, because these agents can increase the absorption. Iron requires a very acidic environment. That's why I want you to make sure that you avoid taking it with food and avoid taking it with proton pump inhibitors or H2 blockers. If you really need an acidic environment, you can take it with vitamin C. Vitamin C 200 milligrams, that can cause your stomach to have that acidic environment, which is best for the iron supplement. I also want you to be very aware of a normal side effect. I think when you first begin to take it, if you see the side effect, you'll think something is really alarming and wrong, but that is not the case. Iron can cause constipation. It can also cause your stool to look like this dark, tarry color. Do not be alarmed. This is a very typical and normal side effect with iron supplements. What can help is if you take stool softeners. Stool softeners will help reduce the induced constipation. So if you have any friends or family that has anemia, you know they have an iron deficiency, it is so very important that you at least take some sort of iron supplement because you are deprived from the iron that your red blood cells need to carry oxygen from your lungs to your tissues. So make sure you send this video to your friends or family who is always cold.